Hello, everyone. Welcome back. So in today's episode, we have a very special guest. With us today is Dr. Morgan Massingale. Dr. Morgan is actually our newest doctor here at my practice at Ethos. So I'm super excited to have her on today. And today we are going to be talking about pain syndromes in women, particularly the hormonal aspect of pain syndromes in women. In women, a lot of the time, pain is one of those things that isn't super well treated because we don't take a very global approach to it, and we don't look at the different contributing factors. We just look at kind of the joint, the injury, and what we can do to treat that. And so I'm really excited to have Dr. Morgan on. She's going to have a ton of information. So for those of you who are new to my channel, I am Dr. Alexandra. I am a naturopathic physician here in Scottsdale, where I specialize in women's health and aesthetics. And this channel is for you if you are looking for more information on all things women's health, hormones, skin, pain, all things women's health. So if you're liking the content that we're putting out, go ahead and like it, and go ahead and hit the subscribe button because that would really help us. So diving right in, welcome, Morgan.
Thank you so much. Thanks for having me on your channel. Thanks for welcoming me into your practice. I'm super excited to be here.
Absolutely. We're so excited to have you. So I'm really excited to do this topic. First of all, Dr. Morgan actually just finished up her residency in regenerative medicine. So sports medicine and regenerative medicine in specific is Dr. Morgan's specialty. But I think the approach of looking at hormones along with regenerative medicine is a really important aspect of that. So can you tell me, in your female population, how much of your population is having some sort of hormonal imbalance that's leading to some of their difficulties with their sports medicine conditions?
I'd honestly say the majority. I think we need to open up the scope of what we're thinking of in terms of assessing women and their hormones. I think a lot of times we just think about the typical suspects of like estrogen, progesterone, right? But there's so much more that goes into that. And we're really well suited as naturopathic physicians to kind of investigate all of those things, how they all work together, and make sure that all those things are optimized so that you're getting the best out of your health and the best out of any regenerative treatment that you decide to pursue.
Yes, I love that. So one of the things that I notice in my practice is that a lot of the times in medicine, we are very good at putting blinders on. Like, I treat your thyroid, blinders, nothing else can contribute to that. I treat your female hormones, and that's it. And really, hormones play a role and they all play together. And so that global approach is really, really, really important.
One of the things I love to talk about with my patients is kind of, I equate it to almost a stool. Like, you have a stool that has 3 legs, right? And each of those legs is represented to me by the thyroid, the adrenal glands, and then your sex hormones. If you kick out one of those legs, the other 2 cannot hold that stool up on their own. They will do their darndest.
Yes. Yes.
But you really see a drag on the whole system. And so, you need to figure out which one was the initial culprit and help that system out so we can get everything back on track.
I love that. So if we're diving into pain syndromes and sports medicine conditions, what in those 3 stools are you looking at, and how is it affecting, like, how are you seeing it present in your office?
Yeah. So, we can start with our thyroid gland. A lot of times, if you have a hypoactive thyroid, you'll see a lot of joint stiffness, joint pain. And you really want to make sure that you have someone looking at that bigger picture, because if you walk into an orthopedic surgeon's office, they're going to look at that joint, not paying attention to the other things that are going on. When you really could be helped out and optimized by making sure you're on a good, iodine supplement, if that's appropriate for you, or if it's appropriate to go, pharmaceutical route, that's something you should be looking at and discussing.
Yes, absolutely. And with thyroid, it's one of those things where when women come in the office, the majority of women that have come in my office have already had a thyroid panel run, and it's always missing something, or almost always missing something. So I've done a lot of videos on thyroid panels, what they should include in them, including things like reverse T3, including things like TPO antibodies to check for autoimmune conditions. So I think that that's an area where honestly a lot of good testing is really missed. So that's definitely something that our population should look out for in the future, because we'll do more videos on that. I think it's really, really important. With thyroid, oftentimes with thyroid, you can also see joint, like you said, joint stiffness and pain, but also muscular weakness and like some neuralgia, correct?
Exactly. Yeah. So you really need to be making sure that all of that is in check. Otherwise, you're going to be chasing symptoms for a long time, really not getting at that root cause of what's really going on. And a lot of times we do see that kind of negative draw on the thyroid with prolonged stress. So we also need to be looking at the adrenal glands in that condition. One of the things that we see with chronic stress and chronic high cortisol, so stress and taxation on the adrenal glands, is the laxity of the ligaments that hold your joints in a steady position. So those static stabilizers. And also you see the dysregulation of sugar metabolism with those patients, which can also lead to, joint pain, fatigue, those sorts of things.
Inflammation.
The holy like triad of things, right?
Yes.
And so you really need to get that optimized to be able to get in, stabilize those joints, that we're healing appropriately, and make sure that we are getting down to the root of what's causing your pain and discomfort.
Great. So if you're looking at thyroid and cortisol, is there one that you would check first, or do you always check both together?
I usually check both together, to be honest with you. When patients come in, unless there is some reason not to, I'd like to take a look at the sex hormones, the adrenal glands, and the thyroid right off the bat, just because, with that bar stool analogy, when that one leg starts to go and it draws on the other, we just want to make sure that we're optimizing everything that we can within that HPA axis and not ignoring one of those legs.
Absolutely. So oftentimes in women, it's common in women to have what's called an SI joint dysfunction. So basically your SI joint, right, the ligaments in your SI joint won't hold your pelvis in place quite as much, and you can end up with low back pain. What other symptoms do women end up with SI joint dysfunction?
Whenever I have a patient come in, I was just talking to Dr. Matt about this, honestly. Whenever I have a patient come in with low back pain or any symptoms down the legs, so paresthesia, like numbness, tingling, burning sensation, any radiating pain down either leg, it's the SI joint until proven otherwise. In my list. And that really is one of the places that we kind of look to with that ligament laxity that I was talking about. If those ligaments, and they're very big, thick ligaments in the back, can't hold that pelvis steady, what happens is the glute med and the glute min underneath your glute max, which we're all more familiar with, kind of clamp down to try and hold that joint steady. So you'll get some cramping, spasm sensations in the low back and buttock region. And also one of the things that happens when that, clamping of the muscles happens is it compresses that sciatic nerve, so that giant nerve that provides sensation and motor control to the leg. And so you have patients that then will come in saying they have sciatica, that sort of thing. When really it's their SI joint that needs to be addressed. So, we have that high cortisol situation, those ligaments get lax, that joint starts moving, you start having this radiating pain. And that's really common, especially in highly driven, highly motivated females. I don't think we know any of those, do we?
No, we don't know any of those. Just our entire practice.
And you'll see these, especially like, I just recently, got out of medical school a few years ago. You see people, and you can almost pick them out as you start to pick this up in your practice. They fidget in the back of the room. They can't quite get comfortable in any one position. They're changing positions, trying to ease their low back, trying to alleviate that pressure in their low back. People are prime, high cortisol, ligament laxity individuals. So that's, one of the kind of characteristics you keep an eye on when you're meeting a patient for the first time, or how are they sitting in their chair, that sort of thing. It's really important.
That's a really great assessment tool. I honestly didn't think about that, but I know for myself, I do have a lot of hip dysfunction that I'm working on, and the small muscles in my hip do not fire very well at all. And that was one of the things that I was talking about with my physical therapist. She was like, "You move a lot, don't you?" I was like, yes. What do you mean? And so, yeah, that is a good thing to look at. So when you're treating that ligament laxity, especially for like, stick with the SI joint, low back pain, when you're treating that ligament laxity, getting the cortisol in check is going to be really important, and assessing the thyroid is really important. But there is a good chance that's not actually going to heal up the ligament and create a proper ligament laxity. Is that correct?
Right. So once that ligament has become stretched, you might need some higher level interventions, such as like a prolotherapy injection, something like that, to actually get those ligaments to tighten back down and kind of heal appropriately. So prolotherapy, I don't know if you've talked about this on your channel before.
I haven't. I would love to talk about this. Yes.
It's kind of an umbrella term. Prolo meaning proliferative. And so what you're doing is you're targeting that tissue, and you're asking it to regenerate. And you can do that in a variety of ways. Traditionally, you can use a concentrated dextrose solution, so sugar. Sugar is a natural irritant to the body, so if you place it very directly, you can get the immune system to do some pretty nifty things. Kind of higher level from that is platelet-rich plasma. I'm sure you've talked about that with some of your aesthetic applications. So concentrating that portion of the blood that's the richest in growth factors, platelets, that sort of thing, and injecting it into that tissue can really help boost healing and regeneration of collagen. And then higher level, you get into some like stem cell therapies, that sort of thing. But you know, the majority of patients don't need to go to that higher level intervention of a stem cell therapy. They're really well served by the dextrose or PRP therapies.
Yeah, I'm so glad that you mentioned that. That is one of the things that we notice in our practice, like Dr. Matt notices in our practice with his sportsman patients, is the majority of patients aren't needing to go to stem cell. And we have a lot of patients that come in our office that are confused about what stem cell actually is, because they're being told that if they get a product, like an amniotic growth factor product, that is stem cell, and it's not. So stem cell, for those of you watching, has to come from you. It has to come from bone marrow or fat. And the majority of people, like Dr. Morgan just said, don't actually need to go that further step, because they will be really well served with prolotherapy or PRP or a mixture of that, depending on kind of how far along they are in the condition and how well they deal with inflammation.
So I had a colleague in the past that came up with a really good analogy, and so I've continued to use it. So prolotherapy you can kind of think of as, if you think in terms of your yard, you may need to trim the hedges, you probably need to mow the grass, you know, maybe plant some new flowers, but you know, it's not like a major landscaping job. PRP, you might have some patches in the grass that need to be addressed. You know, you might actually need to get a little bit more aggressive with some things. Stem cells, you need a whole darn new yard. And that's the level that you're at when you need stem cells. So
absolutely, I love that. So that means that when we're treating something like a ligament laxity, what we're going to do is we're going to run hormones at the same time, probably, right? And then that's really going to be our focus for making sure that they don't end up in that situation again, and that they can actually heal appropriately, build new collagen, et cetera. Is that correct?
Yes, exactly. So you want to make sure that you can build collagen. And in that aspect as well, you want to make sure that you're getting proper nutrition. So do you have enough protein to do healing in your diet? Do you have enough magnesium for your muscles? You know, those sorts of things that really need to be addressed before you just go diving into a regenerative injection therapy.
Yes. Yeah. And I love that. I think it's so important for sports medicine, but I honestly think it's so important for all regenerative medicine treatments. And I think it's something that's missed, especially in the aesthetics community. Like, I can't tell you how many patients come into me for hair loss. And when we're talking to them, a large portion of them have ended up being vegan and then intermittent fasting on top of that. And so they're getting zero protein, not enough calories, and they're having hair loss associated with it. And I think it's a lot of clinics that are just very quick to inject, right? And so you really have to assess the underlying cause.
No, injections are sexy and they're fast. But you don't want to neglect the hard work, making sure your stress is in check, making sure that your sleep is addressed, making sure that your nutrition is not, out of whack. And it's hard work. It's tough, but it's really important if you want to get the most out of your healthcare.
It is. I completely agree with that. Sexy is not always best. So that's good. So that kind of somewhat leads me into our next conversation, which is going to be on female sex hormones. So we're talking about building collagen. And I know from the aesthetics world, right, that women tend to lose about, and it is technically women and men, but right now we're talking about women, tend to lose about 1% of collagen per year after the age of 30. But in the first 5 years of menopause, we'll lose about 30% of their collagen. So it's huge. We know that estrogen plays a big role in being able to not break down collagen quite as fast. And we know that it plays a big role in being able to build collagen, as does testosterone. So can you talk to me a little bit about female hormones? First of all, let's go menopausal.
Sure.
And then let's go maybe younger.
Yeah. So, like you said, when you see that drop in estrogen and testosterone as we age, which doesn't have to be the case, let's just side note that right now.
Yes.
It does lead to the breakdown of issues. A lot of times you consider it with women's health more in the, vaginal dryness, vaginal irritation, that sort of thing. But it is also vastly and hugely important with joint health. Collagen makes up your ligaments. It also makes up the surfaces of your bones where they articulate, making sure that those bones don't rub against each other. If you can't properly turn those tissues over, you will see a more rapid breakdown in your joint health.
Yeah. So I love that you said that it doesn't have to be that way, because obviously, right, the definition of menopause is that we pretty much stop producing estrogen and progesterone, but testosterone, you don't have to have that rapid of a decline, and many patients don't. And one of the things that I'm seeing a lot in my office, I don't know if you're seeing this, but I'm seeing a lot where younger women, like 30, are having extremely low testosterone. Yeah. And that's something that I actually did talk about in a previous video. So I'm going to link that video here in the show notes so that people can go and watch it, because there's a lot of lifestyle contributing factors. And I think that when you're thinking about testosterone in a 30-year-old woman, you really have to look at a bunch of different factors, right? Looking at sleep, mitochondrial health, oral estrogen use. So like birth control pills play a big role. I think there's a bunch of factors that people don't think about. Are you seeing that in your population?
I am absolutely seeing that. And it's interesting because a lot of times, the woman will present with joint pain, but what she hasn't talked about with her doctor or with her partner is her lack of sex drive. Her sex drive is tanked in the same time frame that she started having all of this joint pain. Those things are connected. And it's really important to know that those are connected. You have this higher level hormone of progesterone that has two ways to go. It can either go into our sex hormone pathways, or it can come down to cortisol. Unfortunately, in our lives and, this pandemic world that we're living in right now, our stress is at an all-time high. You've got women in their 30s, as you're saying, that a lot of times, have their partners home full time because everyone's working from home. They've also got their kids home full time, and they're still trying to run their jobs and live their lives and maintain their houses. And that's a lot to ask from one person, right?
It is a lot to ask. Yes.
Oh my goodness. Yes. And so you have this huge progesterone steal down that cortisol pathway, trying to, keep that cortisol running so you can get up and go and try to do all those things that you're needing to do. And it just steals from that sex hormone side. And so that's where you start to see all these negative effects of not enough estrogen, not enough testosterone, too much cortisol, and it's all teaming up against you. So, you need someone on your side.
Absolutely.
Helping you bring things back into balance, right?
Yes. Yeah. And I think that it's one of those things where I notice in my women, because I do treat a lot of just very driven, high functioning women, that myself included, oftentimes I ignore things until it like
Of course.
absolutely is banging me right in the face, like till I can't go any further, and then I will deal with it. And I think a lot of women are like that because they don't necessarily know what to do about it, and they just think, okay, well, I'm low energy, my sex drive's a little bit low, I'll just power through
Or
without
the
actually
other,
treating it.
the power through is a big thing for women. And also what I see is we've been told somewhere along the way that that's normal.
Yes, yes, 100%, 100%. Mm-hmm.
The number of women that I have come into my office that have seen other providers and they feel garbage, and they will tell you that they feel like garbage. Some other provider has run their labs and be like, well, this is normal, so this is just how you're going to feel now. Like, that's not acceptable.
It is not acceptable.
Acceptable.
And I 100% agree with you. The amount of women that sit across from me that say, my doctor just said this is what happens, like when you hit my age. I'm like, no, you don't just hit 40 and then all of a sudden you're like, well, I'm stamped out, like everything's
Had a good
behind me.
run.
Yeah, it doesn't work like that. Yeah, so I think that's really important. And I think managing stress is really important. I'm really glad you brought up that steel to cortisol, because one of the things that I think women don't realize is your body is designed to keep you alive. That's what it's really good at, right? And it's going to do it. And if it comes down to it in a time of stress, the first thing that the body goes is, well, I don't need to be pregnant, so I don't need any progesterone, and I don't need any testosterone because I don't need any libido. I don't need these things. I just need cortisol. And so if you don't deal with that underlying cause, you're never going to get anywhere. So I think that's really important.
Our body was very intelligently designed for the Stone Age, right? When the biggest stress threat was the bear that attacked your village momentarily. We've got a constant bear in our face all day, every day. We need to learn how to shut that down.
Yes,
we can reset our system and take control. So.
Absolutely. I think that's really, really important. So can you talk to me about estrogen in younger women? So we talked a little bit about menopause, right? And we know that menopause, estrogen is going to decrease your collagen production. That just is one of the things that happens in menopause. But talk to me a little bit about estrogen in younger women, because that's not normally a low estrogen, although it can be. So can you talk to me a little bit about that?
Yeah, absolutely. So a lot in younger women, what we see is more of an estrogen dominance picture. And that doesn't necessarily mean that estrogen is super high. It means that the ratio of your estrogen to your progesterone isn't quite right. So it could be that your progesterone is super low. And so what we see with that is a really increase in inflammation body-wide, which a lot of people, it presents as pain. And the other thing that you'll see with an estrogen dominance picture is, heavy and irregular menstrual periods, that sort of thing. So again, making sure that someone is looking at that entire picture of how you're feeling to address, and get you optimized, get you feeling better.
Yeah, absolutely. Is there anything else that you're noticing, or any tips that you have for our viewers on joint pain?
Oh man.
Or I guess muscle pain. Either one. Pain syndromes.
I really would encourage, if you're not already working with someone, working with a provider that is going to look at that entire picture, run appropriate labs, and know how to take you through them. If a provider is running labs and just saying these are normal and not explaining to you why or how, you should probably think about seeing somebody else. One of the biggest things that we do as physicians is teach you how to take control of your health. Help you understand how all of these things come together, why all of our crazy off-the-wall questions that seem unrelated really are related, right? So that there's no person that understands your body better than you. And making sure that you understand how all of those things come together so you can address it yourself, and then also bring up appropriate things with your physician and get the care that you deserve.
Yes, I love that. I think if you're seeing somebody who, if you get the gut feeling that the person that you're seeing ran down your labs to make sure that there's nothing that showed up literally red on your labs and then said, yeah, you're good. That's not, you're talking optimization, and especially with things like thyroid, right? I've had patients where they've come into me and they've said, I felt like junk for the last 5 years, and I've had my thyroid run 5 different times and nothing ever comes back. And this is my last set of labs. And I take one look at it and I'm like, yeah, you're hypothyroid. Like, yes, you are hypothyroid. And it's because it's not right out of the reference range yet. And so I think that those conversations about optimal is important. Yeah. And optimal is way different than a red lab value.
Yes. Yeah. So labs come up with their normals based on what's common in the population. Unfortunately, what's also common in the population is not feeling great.
Yes.
So
yes.
We don't want to rely on those normal lab values. We really need to look at, levels that are going to make you feel the best.
Absolutely. I love that. And then is there anything with joint pain that you see come in your office that you think, man, I wish people would just stop doing this?
There's a lot of things. Inappropriate training. I will always advocate for you to be healthful, exercise, get strong. I think that's so, so important, especially as women. But you really need to do that mindfully and with someone who knows what they're doing. I would not recommend, Jane Doe that hasn't worked out since she was in her 20s and now she's in her 40s to go start doing deadlifts on her own. That's just not appropriate. You need someone who knows what they're doing to help, get you on the right track and build strength in a really mindful way.
I love that. Strength training is one of the number one things that I think women can do differently. And I love that we are going from, we used to be like cardio bunny, right? Just run for hours and eat nothing and that'll work. And now society is going different and strong is becoming what women are looking for. But in that, finding the right trainer is important. Finding a trainer that actually knows what they're doing.
Mm-hmm.
And
train women like you train men. That's very important for your trainer to know.
Yes.
And also, muscle is medicine. It's not that you are going to be the big, bulky bodybuilder. That's not what we're looking for, unless that's what you want. And then, hey, more power to you. We'll work on that. We'll get you there. But being lean and strong and mean, like that's
yes. Mm-hmm.
It's going to be helpful for your hormone metabolism. It's going to be helpful for your mood. It's going to be helpful for so many things.
Absolutely. I love that. Well, I think that this was a fantastic episode. For women watching, I would definitely encourage you to get a really good hormone panel run. If you are still menstruating, this will mean getting hormones run on multiple days in your cycle. For the most part. So it can be a little bit more complicated in younger women, and your doctor should be at least having a conversation with you about when the optimal time to run your labs is, because just any given day in a menstruating woman is not going to give you very good information. And then in menopausal women, it does become a little bit easier because we can run them pretty more consistently. But getting your hormones run is going to be a really, really important part if you have any sort of pain. The other thing I think to realize in this episode is that you don't have to live with pain. I know a lot of people think, oh, I'm just getting older, back pain's normal, everybody has back pain, whatever it is.
No,
not normal. And so thank you so much, Dr. Morgan, for coming on and for sharing all of your wisdom with us. I'm super excited to have you on. And then for our viewers, if you like the content that we're putting out, please go ahead and like it and share it with somebody that you think will help. We definitely want to get this information out there and help as many women as we possibly can. And the only way we get to do that is by people like you liking and sharing our content so that it can get out to the world. Thank you so much again, Morgan. Have a great day.
Thank you. You too.